keep everybody in mind that all this information in this training is, again, just to bring awareness on the subject of mental health for yourself, as well as your job as an interpreter. So do not use the information to diagnose any friends, family, or those around you. So today's topics will be covering therapy and counseling styles that you may encounter, as well as the different kinds of professionals you may also encounter, such as psychologists, psychiatrists, etc., and the different medications for the mental health illnesses, as well as mental health related problems, boundaries and roles of the interpreter, and ethics, which both will be presented by Robert. Okay, so to start off, therapy and counseling styles. So during counseling, therapists and counselors will use psychotherapy, which is also known as talk therapy. And this is when an individual speaks with a trained therapist in a safe and confidential space to explore and understand feelings and behaviors, as well as gain coping mechanisms. So the following slides will discuss in depth of the various psychotherapies, such as cognitive behavioral therapy, CBT, dialectical behavioral therapy, DBT, eye movement desensitization and reprocessing therapy, EMDR, exposure therapy, interpersonal therapy, mentalization-based therapy, and psychodynamic therapy, as well as therapy pets. So after each specific therapy, I'll show a video for everyone to have a more visual understanding of that specific therapy. And again, many of these therapies can be used to treat the same mental health illness or mental health related problem, but it depends on what works best for the individual. And this would be discussed between the therapist or counselor and that individual throughout therapy sessions. So first we have CBT, cognitive behavioral therapy, which focuses on exploring relationships among a person's thoughts, feelings, and behaviors. So during CBT, a therapist will actively work with a person to uncover unhealthy patterns of thought and how they may be causing self-destructive behaviors or beliefs. And by addressing these patterns, the person and therapist can work together to develop constructive ways of thinking that will produce healthier behaviors and beliefs. So mental health illnesses that may improve with CBT may include depression, anxiety, phobias, PTSD, sleep disorders, eating disorders, OCD, or bipolar, or schizophrenia. So here's just a video that explains a little bit more about CBT.
You just broke up with your partner. You had an argument with your best friend. You got let go from your job. A loved one gets sick. At some point in everyone's life, they may feel sad or gloomy. For most people, it's a fleeting feeling like a passing storm. Eventually, the rain clouds clear. The sadness fades away. For me, though, the sadness didn't go away. It went on for weeks. I felt awful and I didn't know what to do. My symptoms felt like I was being knocked down over and over again. I felt hopeless. I lost interest in things I normally enjoyed, and I really didn't have much of an appetite anymore. I finally talked to my doctor and he encouraged me to see a mental health professional. You know, like a psychiatrist. The psychiatrist talked to me about my symptoms, how long they had been going on, and how they were impacting my life. She ended up prescribing me medication to help with my symptoms and talked about the potential side effects. She also explained that it's important to approach treatment for mental illness using a wide variety of tools and resources. So in addition to my medication treatment, I also started meeting with a therapist. My therapist introduced me to cognitive behavioral therapy, or CBT. CBT is another treatment option for people with mental illness. CBT is an evidence-based treatment, which means it is based on scientific research and clinical expertise. CBT focuses on relationship between thoughts, feelings, beliefs, and behaviors. Negative or inaccurate thoughts are challenged and restated in logical, positive terms. When my psychiatrist explained my diagnosis, I felt hopeless, like I couldn't find a solution to help put the pieces of my life back together. As I continued to learn about cognitive behavioral therapy, it became clear that I was having a lot of negative and irrational thoughts that did not match up to facts. I would say things such as, my boss hates me, she's always giving me more work, I'll never get that raise. I'd like to hang out with my friends, but I'll just bum everyone out. I don't want them to get mad at me. I used to see things as one big mess. I'd look at my house and get overwhelmed. I'd say to myself, I'm such a slob, I can't handle this. I was quick to call myself names, believe the worst of myself, and downplay any positive parts of my life. I'd get discouraged and avoid dealing with my problems. Cognitive behavioral therapy helped me learn how to rethink and reevaluate how I saw the world. CBT taught me how my negative thoughts would team up with strong emotions and shut me down to further depress me. I can see clearly now that I was regularly interpreting most things in my life in a very negative manner. By learning to recognize extreme negative thinking, I was able to change my thoughts into positive statements. My boss gives me the important tasks because she believes in me. I know I can handle things. Taking this approach gave me the confidence to talk to my boss about getting a raise. We had a great discussion, and she told me the steps I could take to advance my career. Little by little, my therapist helped me realize the unproductive thoughts and behaviors I was creating. CBT also refocused me towards problem-solving techniques. I began facing my fears using positive reinforcement techniques, and in time, I started to calm myself on my own. They're my friends. They love me. Being myself is all they've ever wanted. Cognitive behavioral therapy helped me learn how to stop attacking myself and instead think more productively. By changing my thoughts and setting logical goals, things started to get easier to manage. I learned to see things as individual parts that I dealt with one at a time. Just start with the clothes, and when that's done, move on to the dishes, just a little at a time, and you'll get it done. By taking ownership of my feelings and thoughts, my behaviors changed for the better. At times, I didn't think my symptoms would get better, but I kept going. I fought back. I stopped allowing myself to use negative thinking about myself to go unchecked. I've taken a fearless inventory of myself, and through hard work, I've been clearer in my thoughts and feelings. I'm proud to say that I am on the road to taking my life back. The cognitive behavioral therapy skills I learned, along with my medication, have helped me to put the pieces together. It's not always easy, but I now know that I can take the steps to handle problems when they come along. By learning more about CBT and how it can help me, I feel more put together and healthy. That's something to feel good about.
Okay. Hopefully that video was helpful for everybody. Next, we will go on to DBT, dialectical behavioral therapy. So DBT has been adapted to treat people with multiple different mental illnesses, but most people who are treated with DBT have BPD, borderline personality disorder, as a primary diagnosis. DBT is a more specific form of CBT that focuses on helping people who tend to have extreme emotional reactions interact with their environment in a less emotional and healthier way. So DBT focuses on helping people change their behavior patterns as opposed to trying to think or talk through the issues they are struggling with, which is why this helps with BPD, since this type of CBT helps those who have developed patterns of intense emotional reactions and impulsive behaviors in response to what patients describe as overwhelming feelings of pain and rejection. So overall, DBT emphasizes validation or accepting uncomfortable thoughts, feelings, and behaviors instead of struggling with them. Again, here is a video talking about DBT more in depth.
So I want to talk to you a little bit about dialectical behavior therapy, or DBT, and discuss the 4 important components that make this such an effective therapy for people struggling with borderline personality disorder, which is one of the most painful and difficult conditions that anybody can be facing. I'm Dr. Sonia, and I'm a licensed clinical psychologist who has worked with a number of individuals over the years struggling with borderline personality disorder. I was trained in dialectical behavior therapy, which is the evidence-based treatment for borderline personality disorder, and that has had significant success in relieving distress in a number of people who in the past were seen as untreatable and unworkable. And since this therapy has come out, it has brought hope and help to people who otherwise would have had to struggle with this on their own. So there are four main components of dialectical behavior therapy, or DBT, and these include an understanding of mindfulness, learning skills for emotional regulation, learning skills of distress tolerance, and learning skills around interpersonal effectiveness. And through learning these skills and working with a DBT therapist, people with borderline personality disorder find significant relief and a sense of structure and stability over something that previously felt really uncontrollable. So the first component of DBT that I mentioned is mindfulness. And this is the idea that we need to be really present, non-judgmental, and aware about our present current circumstances. And this is a very, very important skill for people, for anybody really, but specifically people who struggle with kind of an unstable sense of self and a difficulty with staying kind of grounded and focused in the present moment. The second skill that DBT teaches to people who have borderline personality disorder is emotion regulation. And there's a couple different aspects of this, but essentially it's the idea of learning to be comfortable with and accepting of your emotions, and then learning how to manage difficult emotions so that they don't end up controlling you, but that you have the ability to choose how you react in any given situation, despite what you might be feeling in the moment. Distress tolerance is also a very important skill that's taught to people who are in DBT. Distress tolerance is really this idea of when your situation seems unbearable and intolerable, what are some things that you can do, healthy things that you can do to manage your behavior and your emotions so that you don't do something impulsive or risky that ends up having negative consequences for you down the road. The final component of DBT, which is really helpful for really anyone, is interpersonal effectiveness. And this is just the idea that through learning how to communicate in healthy, respectful ways with others, to assert ourselves and to have really good boundaries, we can then have more stable relationships with others and build trust. And this is so, so important for people who struggle with borderline personality disorder, because trust is one of the things that they have the hardest time with. So interpersonal effectiveness really gives them the skills to start to have better relationships with others. So if you or someone you know either has been diagnosed with borderline personality disorder, or you suspect that someone you know might have borderline personality disorder, I strongly encourage you to get in touch with a qualified DBT therapist, because it's one of the most effective and evidence-based ways of dealing with this diagnosis and really helping you lead a happier, healthier life. If you like this video, please feel free to subscribe to our YouTube channel, where you'll find a lot more content on a variety of mental health topics. And if you're interested in learning more about online counseling, please click the link to betterhelp.com below.
All right, now we're going to move on to EMDR, which is eye movement desensitization and reprocessing therapy. And this is typically used to treat PTSD. And a number of studies have shown it can reduce the emotional distress resulting from traumatic memories. So EMDR replaces negative emotional reactions to difficult memories with less charged or positive reactions or beliefs, performing a series of back and forth repetitive eye movements for 20 to 30 seconds, and can help individuals change their emotional reactions. So next, this is a about 10-minute video that demonstrates what EMDR looks like in a therapy session, specifically eye movements, tapping, and vibrations.
Enjoy it. Enjoy it. Okay, so today we're going to be processing that memory of your parents yelling at you when you were a young girl, right?
Mm-hmm.
Okay. So would you be able to tell me the image that represents the worst part of that memory?
I think the thing that stands out the most is the image of me in my room crying alone.
Mm-hmm. When you hold that image of you crying alone in your room, are there any negative beliefs about yourself that feel a little true right now that go along with that image?
I think what comes to mind is like I'm bad, or I'm a bad daughter.
Okay.
I'm a bad kid.
Okay. Is there a belief that you would prefer to feel about yourself that would go along with that image?
I would like to believe that I'm good. I'm a good daughter. I'm a good person.
Okay. As you hold that image in your mind of you alone crying in your room, and you say the words to yourself, I'm good, I'm a good daughter, how true does that feel on a gut level, on a scale from 1 completely false to 7 completely true?
Probably like a 1.
Completely false.
Yeah, not too true.
Okay. As you hold that image in mind and you say the words to yourself, I'm a bad daughter, what feeling comes up right now?
Like shame, guilt, sadness.
Where do you feel that in your body?
In my stomach.
And right now, how strong is that feeling from 0 to 10?
I'd have to say like an 8. Pretty strong.
Can I ask you to take the image,
mm-hmm.
that negative belief of I'm not good, I'm a bad daughter,
mm-hmm.
and those feelings of shame and guilt,
mm-hmm.
and can you go with it?
Let's do it.
Okay. Okay, Mom.
I just had this memory of my mom being outside my door and calling my name.
Go with it. Okay, Mom.
I remember I thought she was, coming back to yell at me some more, but I think she was more concerned that I was all alone in my room because even though they yelled at me, they didn't want me to be upset and alone.
Okay, go with it.
I guess maybe I feel, I don't know, a little better, like just that when she came to, talk to me or was calling my name, it made me think maybe I wasn't like the worst daughter ever, like because she was still a little concerned about me, even though she was mad at me.
Okay. Would you be able to go back to that original image for me? Can you get that back up?
Sure. Mm-hmm.
Do you notice any disturbance?
Yeah, I still feel like a pit in my stomach, kind of.
Okay. 0 to 10. How strong is it?
Maybe like a 6.
Okay. Go with that 6.
Okay. Can I close my eyes?
Okay. Okay, Mom.
I was thinking about how, like, even though my mom came to my room, I felt like I couldn't talk to her because I was so embarrassed and like ashamed of like what I did. I just couldn't think of facing her.
Okay, go with it. Okay, no.
Just kind of like a lot of like anxiety kind of feelings in my stomach. I don't know, not really any images, just a feeling.
At this point, what I'm going to ask you to do, I'm going to ask you to cross your hands like this.
Okay.
Keep your hands on your shoulders.
Okay.
And I want you to, as you go with it, I want you to tap back and forth.
Okay.
Okay?
Tap.
Yes. So take that feeling of that anxiety and a little bit of shame that you were feeling before.
Mm-hmm.
I want you to take that and I want you to go with it. Okay. What came up?
Just had this thought that even when my kids screw up, I don't think they're bad kids, and I don't want them to feel ashamed or guilty. I want them to feel like they can be honest with me and tell me about it, and just kind of made me think that maybe it's not so horrible that I screwed up then and even now when I make mistakes.
Go with it. Okay.
I was thinking that like I would never say the things that I say to myself to other people, especially not my kids, but probably not any other people. Just made me think like self-compassion might be something I should work on.
Okay. Go with that. Okay. Okay.
Yeah, I was just thinking more about it's hard for me to imagine being compassionate with myself, but I feel like I really need to try to do it because it just doesn't do me any good to always be beating myself up about these things.
Okay. Can I ask you to bring up that original image again?
Mm-hmm.
With that image in mind, do you notice any disturbance?
I think a little bit in my stomach still, like a little pit in my stomach.
Okay. 0 to 10?
It's gonna sound crazy, but it feels like a 1.
It's a good one.
Yeah.
Okay. Can you go with that one?
Yeah.
Okay,
This can sound really crazy, but the song Survivor just came into my mind. I'm a survivor. I just have to, like, I'm not going to give up. I'm going to keep working on this. So for some reason, I just feel more like energized to work on this.
Okay. What happened to that one?
Honestly, it kind of feels like it's a 0.
Okay. Go with that 0. Okay.
I was sort of thinking, like, it's hard to trust this 0. Like, could it really be gone? Like, but I feel like it is gone.
Okay.
It's weird.
Do you remember that belief that you said that you prefer to have, that we said in the beginning? Do you remember what it was?
I'm good. I'm a good person.
Right, I'm good. With the original image in mind, how true does that feel right now on a gut level from 1 completely false to 7 completely true?
That probably feels more true than before. Maybe like a 4 or 5.
Okay.
Something like that.
Go with that 4 or 5. Right?
Okay.
Okay.
I was sort of just saying in my head over and over, I'm good, I'm good, I'm good, I'm good.
Okay. Go with that.
I had like some flashes of things that I've done over the years that were good, like for my kids or for clients of mine, or just at my kids' school, and just it kind of reminded me that like I am good. Maybe not all the time, but a lot of the time.
Okay. So, original image, I'm good. 1, complete false, 7, completely true. Where are we at right now?
I feel like it's a 6.
6?
Mhm.
Okay, go with that 6.
Okay. I kind of feel like, you know what, on the whole, I am good. I have some flaws and make some mistakes, but I feel like I am good.
Did the 6 change?
It's like a 7.
All right, next we'll be moving on to exposure therapy. So exposure therapy is a type of cognitive behavioral therapy, CBT, that is most frequently used to treat OCD, PTSD, and phobias. So during treatment, a person works with a therapist to identify the triggers of their anxiety and learn techniques to avoid performing rituals or becoming anxious when they are exposed to those triggers. So this video is just an example of a exposure therapy in action.
Okay, you did it. That was a really good job. How do you feel?
A little better.
A little better? Okay. All right, what's your level right now?
I would say like 60.
60. Okay, down a bit. Okay, so now we move into the in vivo exposure, right? Okay, remember, we're going to just, in the next 40 minutes or so, handle that leash. Allow yourself to have whatever thoughts that come up or worries you have about it. You can verbalize them. Talk about whatever's in your head, okay? Why don't you pull it out of the bag? Did you put it in that bag?
No, I asked my husband to.
All right, what's your level right now?
I would say 65.
65, okay. All right. What are you thinking?
That is disgusting. I don't want to touch it.
Hold it a little closer to your body. You can hold it with 2 hands. What do you notice about it?
It's a lot of hair
Hair.
and stains.
What do you think the stains are?
I don't want to think of it. I don't know. Saliva, dog poop. It smells so bad. I'm starting to get sick.
Okay, it's all right.
Ugh.
Just let it happen. It's okay. What's that spot on it? Looks almost like it's breaking or chewed up or something. Is that?
Yeah, he chews on it.
Why don't you touch that spot?
Ugh.
Okay. Doing good. Right on time. That's good. What's your level?
Like 90.
90. Okay. What jump? What do you think? What made it jump? What's going on?
I'm just thinking I'm gonna get sick. I really want to vomit right now. And what if that part I touched had saliva? And what if the dog had, like, they have all sorts of things in their mouth.
Mm-hmm. Yeah, they even like their own butts, don't they?
Yeah.
Yeah. And then he chewed on that leash, and you're holding that leash. Wow.
Yeah.
You're brave. Good for you. Okay. I also notice you're kind of holding it away from yourself. Oh, let me show you something. Can I hold it?
Yeah.
Ah, yeah. That is quite a leash. It's old.
Yeah.
And it has been chewed on, hasn't it? So watch this.
Mm. So I have to do that now.
Yeah, I'm not going to make you do anything, you know that. But I think that the more kind of full body contact you can have with that leash, the better the exposure we're doing. Okay. Good. What's going through your mind?
That I'm getting all the bacteria in my skin, and I want to take a shower right now.
Okay. So your urge to wash is coming up.
Yeah.
How strong is it? Give me a rating on that 0 to 100 scale for your urge to wash right now.
Like 80.
80? Okay. Okay. That means you're doing good Oh, good for you. On your face. Oh, yeah, that's great. What else are you thinking? Just keep telling me what's on your mind.
I'm just thinking of all the times I saw the dog biting on it, licking on it.
So is saliva worse than other things?
Yeah,
Dog saliva?
it's just, yeah, I can't feel it in my hands.
What is it that makes saliva worse?
The smell, the consistency, and I know they have bacteria there.
Okay. That's a bigger source of the bacteria.
Yeah.
Okay. Sorry, just keep thinking that then. That's okay. Good.
I'm scared I'm gonna make myself sick, and then I touch my baby and I make him sick.
Mm-hmm. Okay. You're realizing things that I don't think you've described to me before, just handling that thing.
Yeah.
How long has it been since you've touched that leash without gloves?
Like 5 years. Yeah. I used to get the gloves even bleached because I don't want to touch the gloves.
You mean after you used them, if you had to walk the dog and bleach them? Where are those gloves now?
I threw them away because you asked me to.
Good. Good. Okay. Well, after doing this, you can take it for a walk anyway. Right?
Maybe.
What's your level now?
Like 60.
60. Okay. All right. Huh. Going down a bit.
Yeah.
What do you make of that?
Well, I think it's what we talked about. That at the beginning, just the fear of thinking of getting the leash makes me more anxious. So I get that anticipatory anxiety, and then the more I touch it and the more I get used to it, I guess I habituate.
Okay. So one of the things that helps in a moment like this is to try to sort of up the exposure a little bit. Can you put it around your neck? Sort of let it touch the upper part of your body. How's that feel?
Disgusting.
Disgusting. What's your level?
Like 70.
Okay. It's okay.
So we're gonna do this whole session.
Yeah, you've been at it for about 8 minutes or so, 7 minutes, but longer. And touch it to your face again. That was really good when you did that before. Good. You can even touch it to your lips.
You're killing me. It smells so bad.
It smells bad, yeah. You're doing great, though. I know this is hard.
Yeah.
That's right, but you're doing a really, really good job. And this is going to help. It's also going to make it a little bit easier to do what I'm going to ask you to do for homework, which is to take it home again and to touch it every day. So part of your homework will be not only to listen to that imaginal exposure recording that we made, but also to spend about an hour just holding on to that thing, touching your body with it, using it to kind of contaminate other things in the house, furniture, other surfaces, your clothing. You can tie it around your waist while you do things at home.
Also, to note with exposure therapy, there may be different techniques that a therapist or counselor will use with a client or patient, such as flooding, whereas that trigger for that certain anxiety or whatever is making them feel anxious is all given to them at once for them to face all in one session, or they may do it throughout sessions where they expose it, as example in the video where she exposes that trigger slowly for the patient or client, just to keep that in mind. So next we have interpersonal therapy. So interpersonal therapy typically treats depression, but may be recommended with other mental health conditions. And interpersonal therapy focuses on the relationship a person has with others with a goal of improving the person's interpersonal skills. So the therapist helps people evaluate their social interactions and recognize negative patterns like social isolation or aggression, and ultimately helps them learn strategies for understanding and interacting positively with them. Again, here is a 3-minute video that discusses about interpersonal therapy.
What is interpersonal psychotherapy, or IPT? IPT is a focused, evidence-based treatment approach with the main goal to treat depression. Depression is sometimes linked to distress in the quality of relationships and social functioning. Therefore, if this distress is reduced, it will help in depression recovery. IPT involves a detailed assessment which will allow development and an understanding of the interpersonal context of your depression. Then, usually one or two of the 4 focal areas is chosen by you and your therapist, which is linked to the depression. Firstly, the focal area of interpersonal deficits or difficulties in starting and/or keeping relationships going, such as social isolation or involvement with unfulfilling relationships. The grief and loss focal area aims to help individuals manage unresolved grief if the depression is linked to a death in their interpersonal relationships. IPT can help individuals deal with depression, which is often linked to transitions in life, such as retirement, divorce, or relocation. This focal area is also referred to as transitioning. Interpersonal disputes, which is the last focal area, helps in the treatment of a depression which occurs in those dealing with disputes, for example, between partners, family members, close friends, and even within your workplace. Although IPT was originally developed to help those with depressive disorder, it is also shown to be effective in treating eating disorders, perinatal depression, drug or alcohol problems, and mood disorders, including bipolar disorder. A central idea in IPT is that psychological symptoms, such as depressed mood, can be understood as a response to current difficulties in relationships. It attends to difficulties arising every day in maintaining relationships and resolving difficulties, while suffering an episode of depression. The depressed mood can also affect the quality of our relationships. When a person can deal with the relationship problem more effectively, their psychological symptoms often improve. IPT treatment is structured and continuously monitored by your therapist. There may be tasks to practice in between therapy sessions aimed at making changes. These are always discussed within therapy. IPT is also based upon the concept that your social environment is a key factor in the onset of depression. Therefore, IPT targets these areas in order to alleviate these issues. This in turn will have a positive impact on alleviating depressive symptoms. And that is interpersonal psychotherapy, or IPT.
Right, moving on, we are going to go on to mentalization-based therapy, also known as MBT. MBT is a long-term improvement to people with BPD, which is also a different therapy used for BPD. Mentalization refers to the intuitive process that gives us a sense of self. People also use mentalizing to perceive the behaviors of others and to speculate about their feelings and thoughts. In MBT, a therapist encourages a person with BPD to practice mentalizing, particularly about the current relationship with the therapist. Again, this is a quick video about MBT.
Well, the NHS NICE guidelines have a number of recommended treatments, including mentalization-based therapy. And mentalization-based therapy, MBT, helps a client mentalize, which is, it's not a very helpful word, but it's normally thought of as help them to think about thinking. Because what happens when you're suffering from a borderline personality disorder is that you're very caught up in your feelings, and your ability to cope with your feelings is very low. It's very impaired, trying to regulate how you respond to your own feelings. So we typically see a lack of impulse control. A client feels bad and they do something about that by hurting themselves or hurting people around them, or doing something that doesn't help the situation but actually makes it worse. So mentalization-based therapy is working with the client to try and stop that process, trying to interrupt and to get in the way before the feeling turns into an action and to turn it into a thought. So you will work with your client in a very grounding way, trying to really look very closely and analyze moment by moment what's happening to their feelings. And it's a hard therapy because it means you have to bring those anxious feelings into the room. You can't sit there nicely chatting about something that happened last week. You have to almost reactivate it. So you can't work in an MBT way without having some anxiety in the room, but helping and enabling the client to process that anxiety differently, so that they can start to experience themselves as a thinking person who is in charge of themselves rather than somebody who is overwhelmed by themselves. The other part of mentalization-based therapy is to help clients understand that other people have their own beliefs and feelings and needs which might be different to the client's interpretation of those thoughts. So typically somebody suffering from borderline personality disorder will feel persecuted or got at or attacked, when actually in reality they aren't being. So mentalization-based therapy is about helping the client to face adversity and to be able to reflect on it rather than to feel persecuted by it. And it has been described as learning the ability to see yourself from the outside as others see you, and to see others from the inside.
Right, next we're going to move on to psychodynamic psychotherapy, which the goal of psychodynamic therapy is to recognize negative patterns of behaviors and feelings that are rooted in past experiences and resolve them. So this type of therapy often uses open-ended questions and free association so that people have the opportunity to discuss whatever is on their mind. And the therapist then works with the individual to sift through thoughts and identify unconscious patterns of negative behavior or feelings and how they have been caused or influenced by past experiences and unresolved feelings. And this can be used to treat various mental health issues or problems, including depression, anxiety, panic disorders, PTSD, personality disorders such as BPD, stress-related physical symptoms that lack a physical basis, or prolonged sadness. And again, here is a video for psychodynamic psychotherapy.
My name is Michelle Basson. I am a counselling psychologist and also the clinical manager for Harley Therapy. Today I am here to talk to you about different aspects of therapy and how therapy can help you as individuals or as couples. A brief guide to psychodynamic therapy. Psychodynamic work takes many sessions. When a client comes into this type of therapy, they have to be aware that there is no quick fix. You will be actually looking at the psychology behind your behavior patterns in relation to your childhood. The therapist will be looking at your childhood behavior and things that happened during your childhood and how it has affected your behavior patterns in your adult life. It is very close to psychoanalysis, but not quite so in depth. Your therapist will be very much a blank canvas. There will be silences and long pauses during your therapy. Your therapist will be looking at your body language and trying to understand from your reaction to certain issues that are addressed and how the silences and what's actually behind the silences and what they mean. This can be a little bit disturbing for some clients, but if you have this awareness that it is not a therapy that is really constantly a talking therapy, then this could be right for you. This is a very successful long-term process that works very well for many individuals and couples. If you are looking for a therapist, then try and find someone that has been qualified to a high standard, a very high standard, for a long time.
All right, lastly, we will talk about therapy pets, which is spending time with domestic animals that can reduce symptoms of anxiety, depression, fatigue, and pain for many people. Usually hospitals, nursing home, and other medical facilities may sometimes use this as an effect by offering therapy animals. I know for me, when I was in college, during exam week, therapy animals would come in and be used for the anxiety and stress that students would be feeling. Although this doesn't pertain a lot to psychology, to like actual human beings, animals do help a lot with anxiety and depression. And this is a video that describes and talks about how animals help with that anxiety and depression and any other mental health related issues. But just because of time, you can watch this again. This presentation will be sent to you. You can watch on your own time. All right, so now before we go on to break, I'll do a little quiz. It's only 3 questions. So first question is, psychotherapy is also known as, just either unmute yourself and say the answer or type it in the chat.
Talk therapy.
Yes, correct, talk therapy. As I described in the beginning, it is when an individual goes into the therapy session in a safe and confidential area and space and talk about their issues and problems, as well as gain perspective and goals on how they can cope with their mental illness or problem. So quiz 2, what type of therapy or therapies is or are used for the treatment of PTSD?
Exposure therapy.
I'm sorry, could you repeat?
Exposure.
Yes,
therapy.
yes, exposure is one. There is one other one, if anybody knows. Yes, Robert is correct. It is eye movement desensitization and reprocessing therapy, which is known as EMDR. So again, EMDR replaces negative emotional reactions to difficult memories and less charged or positive reactions or beliefs. And exposure therapy is when a person works with a therapist to identify the triggers of their anxiety and learn techniques to avoid performing rituals or becoming anxious when they are exposed to them. This therapy is also used for OCD and phobias. And lastly, true or false, CBT is used by a therapist to help clients to look at their social interactions and recognize their negative patterns in order to learn strategies for understanding and interacting positively with others.
This one's kind of a tough one, isn't it?
Yes, it is. It is a tough. You have to think about it a little bit.
I think it's false because they have to look into, before looking onto how to interact with others, to reflect inwards and see how they can change their behaviors. That's what this is about, if I'm right. I don't know.
Probably it's true for interpersonal therapy.
Yes, that is correct. Yes, actually. Ziba, you were partly right, but yes, it is actually false. So CBT focuses on exploring relationship among a person's thoughts, feelings, and behaviors, whereas looking at a client's social interactions and recognizing their negative patterns is known as interpersonal therapy. So yes, that is correct. All right. So I guess the break, I think that was later on. Is everyone okay with me continuing? I know it's been an hour. Does anybody need a break?
I just, sorry, before that, I have a question, please.
Yes,
so,
no.
Regarding the lady with the dog leash and like putting her through that stress, how is that really helpful? Because she's just reliving it and it just creating the stress and the anxiety from your perspective.
Right.
Like,
yeah. No, of course, it's going to be very, very anxious either way when you do exposure therapy. Again, the point of exposure therapy is kind of just facing head on that trigger or whatever is causing the anxiety. So it's more of like for the client or patient to decide whether or not they feel okay with it. Again, like the therapist who specialized in exposure therapy, she said you don't have to do it. That's your choice. So it's really based on how far the client or the patient is willing to go with the therapist. Again, they don't have to do it. It's their choice. They aren't forced to. It's just if they want to improve their trigger and if they want to face their trigger head on, that's really based and focused on whether or not the client or patient wants to do it themselves. But it is going to be anxious either way because it's again called exposure therapy because it's exposing the client or patient to that trigger or whatever is making them anxious.
I think, sorry, it's just an opinion. Part of that therapy is like to let you know or to contrast your feelings or your fear with the reality. I mean, she was like so disgusted or so afraid of dogs, and she's starting like being in contact with something else that is in contact with the dog, and she realized that yes, she feels bad and she is anxious, but it will actually not, it's not going to kill her, or she's going to be okay. And I think that exposure is what makes you change your thoughts or your feelings.
Yes. Thank you for sharing that. That's a very good perspective, and I would agree with it as well. Yeah. But of course, again, it is very anxious, the therapy itself.
I think for her, it was more she was worried about her baby and not getting the germs and giving it to her baby. So it was not really, she was afraid of touching that because obviously she did before, 5 years ago or whatever. But I think there was an underlying cause which triggered these feelings, right?
Yes, yeah. Most likely, a lot of those triggers, they come from past experiences or what has been, or again, like PTSD from the past. Yeah, most likely. Okay. If there's no other questions, I'll continue. Again, if anybody needs a break, just let me know. I think the break is later on, just because I know it's been an hour already, but I'll continue. So next we're going to go on to professional titles such as psychiatrist, psychologist, etc. So the following slides, we will be talking about mental health professionals that offer guidance to help improve a person's ability to achieve life goals and help assess and diagnose mental health conditions. I want to emphasize this, they cannot prescribe medication. So first we have psychologists. So psychologists hold a doctoral degree in clinical psychology or another specialty known as counseling or education. They are trained to evaluate a person's mental health using clinical interviews, psychological evaluations, and testing. They can make diagnosis and provide individual and group therapy. And some may have training in specific forms of therapy like CBT or DBT and other behavioral therapy interventions. Next, we have counselors, clinicians, and therapists. So these master level healthcare professionals are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs. So they operate under a variety of job titles, such as a counselor, clinician, therapist, or something else, based on the treatment setting. And working with one of these mental health professionals can lead not only to symptom reduction, but to better ways of thinking, feeling, and living. Next, we have clinical social workers. So they are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs again. And they are also trained in case management and advocacy services. Next, we're going to talk about the mental health professionals or professionals related to mental health that can prescribe medication while offering assessments, diagnosis, and therapy. Again, the following professionals can prescribe medication. First, we have psychiatrists. So psychiatrists are licensed medical doctors who have complete psychiatric training. They can diagnose mental health conditions, prescribe and monitor medications, and provide therapy. Some have also completed additional training in childhood or adolescent mental health, substance use, or geriatric psychiatry. Next, we have psychiatric or mental health nurse practitioners. They provide assessment, diagnosis, and therapy for mental health conditions or substance use disorders. And in some states, they are also qualified to prescribe and monitor medications. Requirements are also varied by state as to the degree of supervision necessary by a licensed psychiatrist. Next, we have primary care physicians. So primary care physicians and pediatrics are doctors that we typically go to for our yearly physicals. They can prescribe medication, and you can discuss with your physician about your mental health state, but they will most likely refer or suggest to you to see someone that specializes in mental health. And typically, primary care physicians and mental health professionals should work together to determine an individual's best treatment plan. Next, we have family nurse practitioners, and usually they can provide general medical services like those of a primary care physician based on each state's laws. Like primary care physicians, they can prescribe medication. Again, you can discuss with a family nurse practitioner about your mental health state, but they will most likely refer or suggest to you to see someone who specializes in mental health. And family nurse practitioners and mental health professionals, again, should work together to determine an individual's best treatment plan. Next, we have psychiatric pharmacists. They are advanced practice pharmacists who specialize in mental health care. They can prescribe or recommend appropriate medications if allowed in their state and practice setting. They are skilled at medication management, meaning they can evaluate responses and modify treatment. and they can manage medication reactions and drug interactions and provide education about medication. And many have completed additional training in child or adolescent psychiatry, substance use disorder, and geriatric psychiatry as well. And some other professionals that you also might encounter include certified peer specialists, and these specialists have lived experience with a mental health condition or substance use disorder that's related to the patient or client. They are often trained, certified, and prepared to assist with recovery by helping a person set goals and develop strengths. They provide support, mentoring, and guidance. Next are social workers. So social workers usually provide case management, inpatient discharge planning services, placement services, and other services to support healthy living. And lastly are pastoral counselors, which are clergy members that have trained in clinical pastoral education. They are trained to diagnose and provide counseling, and pastoral counselors can have equivalent to a doctorate in counseling. So for this section, we only have one quiz. You have to really think about this question. So true or false, psychologists, counselors, clinicians, therapists, and psychiatrists have the ability to prescribe medication and offer assessments, diagnosis, and therapy. Yes, majority got it right first. Is false.
Yes.
Yes. Yep, it looks like everyone's getting it right. False. So it's false because psychiatrist is the only one mentioned that can prescribe medication. Psychologists, counselors, clinicians, and therapists offer guidance, help assess and diagnose mental health conditions, but they cannot prescribe medication. Yes, yeah, everybody got it right. All right, next we're going to talk about medication. So going back to what we talked about earlier, research has shown that psychotherapy is very effective in treating mental illnesses. It's usually most effective when used in combination with medication. And a lot of studies have found that about 70 to 90% of people reported an improvement in their symptoms when both psychotherapy and medication were a part of their treatment plan. So just to note, many of the medications help with decreasing and managing symptoms, but does not cure a mental illness or mental health related problem. They overall help individuals with functioning and feeling better in day-to-day life. So first we have antidepressants. So antidepressants are medications commonly used to treat depression, also used for other health conditions such as anxiety, OCD, pain, and insomnia. It's not FDA approved specifically to treat ADHD, but sometimes is used to treat ADHD in adults. Antidepressants work by balancing chemicals in your brain called neurotransmitters that affect mood and emotions, and it helps improve the mood, sleep better, and increase appetite and concentration. And although many people find that antidepressants work well to help reduce the symptoms of depression, some individuals might not feel better right away. It usually takes at least 3 to 4 weeks before any notice in a change of mood, and sometimes it can take even longer. So taking the medication every day as directed helps increase the chance that it works. And about 60% of people who take antidepressants feel better with the first medicine that they take, but others need to try more than one before noticing a change. So specific antidepressants are known as serotonin reuptake inhibitors, also known as SSRIs. So popular types of antidepressants are called SSRIs, and they are worked by increasing levels of serotonin, a neurotransmitter that affects mood, appetite, sleep, and memory. So SSRIs are typically started at a low dose that a doctor gradually increases. So below are the generic names, and in the parentheses are the more well-known brand names. So specifically for antidepressants, you will most likely hear the brand names such as Prozac, Celexa, Zoloft, Paxil, or Lexapro. Other antidepressants include SNRIs, serotonin and norepinephrine reuptake inhibitors include Effexor XR and Cymbalta. And lastly, we have bupropion. or their brand names known as Wellbutrin and Forvivo, work differently than those of SRIs and SNRIs in that it treats seasonal affective disorders and help people stop smoking. Next, we have anti-anxiety medications. So usually these medications help reduce the symptoms of anxiety, such as panic attacks or extreme fear and worry. The most common anti-anxiety medications are called benzodiazepines. And this medication also helps with the cases of panic disorder or social phobia, known as also social anxiety disorder. So benzodiazepines are sedatives that can help relax your muscles and calm your mind. They work by increasing the effects of certain neurotransmitters, which are chemicals that relay messages between your brain cells. And they are typically used for short-term treatment of anxiety. And this is because they can increase drowsiness and cause problems with balance and memory. And the most common brand names include Klonopin, Xanax, and Ativan. And buspirone, also known as Buspar, which is the brand name, is used to treat both short-term anxiety and chronic, which is long-lasting anxiety disorders. And it's not fully understood how buspirone works, but it's thought to affect chemicals in the brain that regulate mood. And buspirone can take up to several weeks to become fully effective. And usually beta blockers such as propranolol usually also help manage physical symptoms of anxiety, such as trembling, rapid heartbeat, and sweating that people with phobias may also have. And again, that is also short-term. Next, we have stimulants. So stimulants increase alertness, attention, and energy, as well as elevate blood pressure, heart rate, and respiration. And it's usually prescribed to treat children, adolescents, or adults diagnosed with ADHD. So the most common brand names of stimulants include Ritalin, Baytrana, Adderall XR, or Dexedrine. Next, we'll talk about antipsychotics, which are used to manage psychosis, or psychosis is used to describe conditions that affect the mind and in which there has been some loss of contact with reality, often including delusions, false or fixed beliefs, or hallucinations. An example would be schizophrenia, bipolar disorder, or very severe depression. And antipsychotic medications are often used with other medications to also treat delirium, dementia, and mental health conditions, including ADHD, severe depression, eating disorders, PTSD, OCD, generalized anxiety disorder. And scientists have also found that psychotic experiences are caused by your brain producing too much of a chemical called dopamine. So dopamine is a neurotransmitter, which means that it passes messages around your brain. Most antipsychotic drugs are known to block some of the dopamine receptors in the brain, and this reduces the flow of these messages, which can help reduce your psychotic symptoms. And again, medication is very important for patients with schizophrenia or bipolar, as I talked about last week, since they are still able to live stable and normal lives as long as those who have schizophrenia or bipolar disorder take their medication. So first, we're going to talk about the typical antipsychotics, and these common brand names are known as Thorazine, Haldol, Trilofan, and Prolixin. So compared to the typical antipsychotics, which are the older generation, atypical antipsychotics are newer or second generation medications, and they're known as Risperidol, Zyprexa, Seroquel, Geodon, Abilify, Invega, and Latuda. And lastly, we'll talk about mood stabilizers. So mood stabilizers are used primarily to treat bipolar disorder and mood changes associated with other mental disorders, and in some cases to augment the effects of other medications used to treat depression. So mood stabilizers help reduce mood changes and prevent manic and depressive episodes. So the most common mood stabilizer is known as lithium and is approved for the treatment of mania and the maintenance treatment of bipolar disorder. And next, under the category of mood stabilizers are anticonvulsants, which are used to be prescribed only for people who did not respond to lithium. And today they are often prescribed alone with lithium or with an antipsychotic drug to control mania. And anticonvulsants are usually worked by calming hyperactivity in the brain in various ways. And the common brands include Depakote, Carbitrol, Lamictal, and Oxystellar XR. Okay, now we're going to go on to our quiz again. There's only 2 quizzes for this section. So what medication is typically used for schizophrenia? Again, you can just type it in the chat or say it out loud.
Antipsychotics.
Yes, correct. Antipsychotics are usually typically used for schizophrenia. Quiz 2, this is a similar question, but what medication is primarily used for bipolar disorder? Yes, B is correct. It is the mood stabilizers. Okay, all right. So I know that was very, very long. It's been about almost an hour and a half. So we're going to take a break. Just have, again, cameras off and mute, and we'll return in 15 minutes. And we'll be talking about orders and roles of the interpreter and ethics, which will be presented by Robert.
I just wanted to point out, let's make it 10 minutes today. So
Okay.
we'll be back in 10 minutes.
Yes, we'll do 10 minutes.
Okay. Hi, everyone. Welcome back. I am going to get started with my portion. Get myself situated here. All right. All right, so I'm going to be presenting on roles of the interpreter and ethics. So to get started, for roles of the interpreter, so what's important to remember with kind of staying within your role as an interpreter, because it's very important that you let the therapist or counselor or psychiatrist do their job and not overstep your bounds. Your ultimate role is to only interpret and to interpret exactly what is being said. You have to remember that you're not there to be as a friend to the client, regardless of how human that might feel for you to do. You kind of have to turn that off a little bit. And you want to make sure that you set your boundaries so that you don't get overly involved with the client. Because if you don't set boundaries, the client may become overly reliant on you. Some examples of the client becoming too dependent on you means that they might be contacting you outside of your sessions, perhaps maybe because you gave your phone number to them or your email to them. That's something that you want to try not to do. Or they might start asking you for favors like rides to the appointment or things like that. You want to try your best to avoid that so they're not becoming overly dependent on you. And it's really important also to not let your personal biases and beliefs intrude into the patient-provider encounter. So, you may have opinions or beliefs about mental health treatment, or maybe the style of treatment, or the way that the counselor is doing their job, but that's something that you want to try your best to keep to yourself, unless for some reason you think it could be endangering the client's health in some way. And you want to try to make sure that you fulfill only the duties of a mental health interpreter while fully engaged in the performance of that role. But to go back a little bit, just as an interpreter, you have an obligation not to let your personal biases and beliefs intrude into the patient and provider encounter. And when you're maintaining professional boundaries, that means that you're only doing your duties as an interpreter, and you're not trying to step in and act in the role of a counselor, a therapist, and a good example of that is, and it's something that happens a lot, I think, because it's a very human thing to want to do, is calming the client down or telling them it's okay, things like that. Those are things that you want to let the provider step in and do, as that's part of their job. Or maybe they want to see how they're handling these emotions. Maybe they want to see the way it affects them to kind of really assess, their reactions and things like that. So in the end, it can be a tricky situation because you never really know what a provider is looking out for in that situation. And that's why it's so important to make sure that you stay within your role and not step outside of it. So, all right, moving on. We're going to go over ethics. This is a big one. A lot of them stay the same no matter what kind of an appointment you take. Whether it's medical or mental health or school or legal or court, it's just that some ethics come into play a little more prominently depending on the type of interpreting you're doing. So there are 3 core values, and this is based on the National Code of Ethics for Healthcare Interpreters. The 3 values are beneficence, fidelity, and respect for the importance of culture. So with beneficence, a central value of the mental health interpreting profession is the health and well-being of the patient. It means that it's your obligation and duty to support the health and well-being of the patient and their family system of supports, and to do no harm. And that's a big part of staying in your role. Because again, stepping outside of your role, you never really know what kind of mistakes you might be making, as you're not the one who's the trained mental health professional. The second core value, fidelity. The essence of the interpreter role is really encapsulated in the value of fidelity. Interpreters vow to remain faithful to the original message as they convert from one language into another without adding to, omitting from, or distorting the original message. And respect for the importance of culture and cultural differences. So as an interpreter, you understand and respect that culture influences the meaning given to symptoms, the diagnosis of those symptoms, the desirability and efficacy of treatments or remedies, and the prognosis. Culture frames the way we interpret the world, our experiences in it, and our relationship to ourselves and others. So a lot of the way you're encountering information and bringing it into your body of knowledge or your perceptions of the world is a lot of that gets filtered through the culture that you're raised in. So it's important to remember that you may have this kind of cultural experience, but somebody else might not have the same one. Even somebody from the same country may not have the same one. Perhaps they grew up during a different style of government. Perhaps they grew up during living in different economic circumstances. So making a lot of assumptions based on your culture or assumed shared culture can sometimes cause you to make some mistakes. So you want to try and respect those differences. So for the National Code of Ethics for Interpreters in Healthcare, the interpreter treats all information in the session as confidential. The interpreter strives to interpret the message accurately. The interpreter strives to maintain impartiality and refrains from counseling, advising, or projecting personal biases or beliefs. I think, as most of you have been interpreters before, I know some of you haven't interpreted yet, but are looking to get into the field. One thing that you're probably familiar with, even if you haven't started interpreting yet, is the concept of confidentiality. And that's, to keep it simple, basically it's, what happens at the appointment stays at the appointment, and you don't talk about it with other people outside of it. That's what this means when it mentions confidentiality. And it's so important because trust is a big part of mental health counseling and therapy. The client has to trust the counselor. The client has to trust you. They have to know that, whatever they say is not going to be getting out into the community, and they have to believe that the counselor therapist is requesting an interpreter who's got those ethics strongly in mind when they're interpreting. Because if that trust gets broken, they may never come back, and that could be potentially fatal in some cases. Some people are really going through a lot of things, and they really vitally need mental health assistance. They may be feeling suicidal, or they may be feeling like they want to hurt somebody else. So if a situation arises where they're feeling like they can't trust the counselor therapist, or they can't trust you, they might just get up and leave and never come back. And we don't want that. We want people to stay and care so that they can keep getting the help that they need. So for accuracy, you have to be able to interpret messages from one language into another without losing the essence of the meaning that's being conveyed, and including all aspects of the message without making judgments as to what is relevant, important, or acceptable. So one thing that you should definitely never ever do, especially with mental health interpreting, is summarizing. You don't want to summarize what somebody said, because then at that point you are deciding what's important. and every little detail could be crucial. And when possible, interpreters should convey the meaning of gestures or body language or tone of voice that add significance to the content of the message, especially when these might not be noted or might be misunderstood by the other party. Depending on what country you're from or what culture you grew up in, there could be certain gestures or body language that is not so familiar to maybe American or Western healthcare professionals, or maybe there could be certain kinds of gestures or body language that Western individuals use that what they mean, but perhaps maybe your client doesn't know what they mean, or maybe the tone of voice doesn't carry across. So it's important to be able to know what those things are and try to, if they require it, explain it. What's important to note, even if an interpreter finds and encounters discriminatory, prejudicial, or derogatory remarks made by either party, you might not want to repeat those things, or you might be unwilling to interpret those things, and it could be, foul language or things like that, or maybe the client is using derogatory terms towards other groups of people. There is a tendency to want to avoid those, but part of accuracy and completeness is interpreting those things, because you have to remember it's not you saying them, it's the client, or it's not you saying them, it's the provider. So just keep that in mind as well. And everything that is said is a potential source of data. So offensive language use by a patient may sometimes be part of their condition. If the interpreter omits that kind of foul language, the provider is losing a valuable piece of data that could lead to the appropriate diagnosis. So we're going to move on from that. Further with ethics, the interpreter maintains the boundaries of the professional role, refraining from personal involvement. So you want to provide transparency in the service that's being provided, and you want to avoid potential conflicts of interest. So that means, if you're showing up to an appointment and you realize that this is your best friend of many years, or this is your mom, you should not interpret for that person, because you're gonna definitely have difficulty maintaining your roles and feeling unbiased or neutral. The interpreter continuously strives to develop awareness of theirs and other cultures encountered in the performance of their professional duties. How we see the world influences the meaning that we give it to experiences and what we understand and what we remember. By developing awareness of your own culturally based understandings and biases, interpreters are better able to focus on the meaning of the messages and expressed by others, and refrain from unwittingly interjecting their own perspectives or biases. The interpreter treats all parties with respect. This is a pretty big one, and it's pretty basic. It should go without saying, but it is something that has to be driven home at times. And this principle reminds interpreters that they have an obligation to treat everyone in the encounter with dignity and courtesy. And that's really important for somebody who's going to seek mental health assistance. That it might feel undignified to them. They might feel, less than, like, what's wrong with me? Why do I need this? And those are feelings that we don't want to reinforce. We want them to feel that they're being treated with respect and with dignity. And we want to respect their rights and the duties of each individual, including your own. When a patient's health, well-being, or dignity is at risk, the interpreter may be justified in acting as an advocate. Advocacy is a big issue. It can be very helpful in some cases, and other cases, maybe not so much. In this case, advocacy is an action taken on behalf of an individual that goes beyond facilitating interpretation, with the intention of supporting what is best for the client's well-being. Advocacy must be only undertaken after careful and thoughtful analysis of the situation, and if other less intrusive actions have not resolved the problem. The act of advocacy should derive from clear and/or consistent observations that something is not right and that action needs to be taken to right the wrong. Advocacy is to uphold the health and well-being, and that social, emotional, and physical well-being of the clients, and ensure that no harm is done. At an advocacy stance, interpreters should undertake this action only after careful and thoughtful analysis of the situation. When deciding to advocate or not, an interpreter should seek the advice of supervisors and colleagues in the field, while remembering to preserve the anonymity of the parties involved when seeking advice. So if you are seeking advice from another interpreter, or maybe somebody at the agency you work at, maybe you can explain some details of the situation, but not in such a way that it would give away who this person is. All right, moving on. The principles contained in a code of ethics are abstract conceptions. What does this mean? So by formalizing a set of principles for appropriate behavior into a code, an emerging profession begins to move away from the confusion of personal preferences and opinions about what is acceptable and what is not. The code of ethics is not a how-to or an answer book for many of the unique and problematic situations an interpreter may face in the real world. This does cover a lot of situations, but a lot of the things you're going to encounter are not exactly black and white, and they don't have 100% yes or no or this or that answers. And a lot of them may be kind of gray, and you really have to think about it a lot. Or maybe you're going to get lucky and you're not going to encounter really any ethical violations or situations where your ethics are tested. And I hope that happens. I hope that you never have to have your ethics tested. But yeah, a code of ethics, as it says here, no matter how concise or thorough, cannot and does not provide definitive answers to all possible dilemmas or choices an interpreter may face. So, after having gone through that, what are the 3 core values of interpreting? You can either speak up or you can use the chat. Let's see, for Ava, fidelity, beneficence, and respect for the importance of culture. Yes, that's exactly right. So those are the 3 core values. Yep, Swan, Midori, good. One thing I wanted to, actually, we're going to move on to the next question. We've got a little bit of time for questions in a few moments. Let me get back to my presentation here. Yep, beneficence, fidelity, respect for the importance of culture. That was the correct answer. Oh, that was the only quiz question. Okay, so for next week, that's going to be Thursday, the 29th of July. We're going to go through cultural differences on mental health. We're going to talk about positioning of the interpreter, physical positioning. I'll be presenting on that one. Lynn will be presenting on cultural differences. I'll also be presenting on how to interpret in mental health settings. And then it'll go back to Lynn, who will be presenting on stress management and self-care and what to expect in therapy. But yeah, thanks so much everyone for coming. Did anybody have any questions about anything we just reviewed? I know it was a lot of information, but if you've got questions, we're here.
Mm-hmm. Yes, and any feedback as well, and anything that you think might be any improvements or just in general comments, that's okay as well.
What about maybe some questions about ethics? Has anybody been maybe has anybody interpreted a mental health setting or even a medical setting where you kind of had like an ethical dilemma, or maybe the practitioner or provider was inadvertently asking you to kind of step outside of your role, maybe because they didn't know how to work with an interpreter very well? So no, it does happen, occasionally when I was the interpreter coordinator previous to being the recruiting and training coordinator, and I would say once a week an interpreter called with an ethical dilemma, saying like, what should I do? Like this happened and the doctor said this and it was not good. What should I do? What should I do?
Ava did have one question. So the medications that we saw, all of them require a prescription. I assume that most of them do require a prescription to be taken because a lot of times people may also take these prescriptions and may also abuse them. So most likely that these do require a prescription for most of them, unless Robert has any other knowledge of it.
Definitely in the United States. I know that in not every country that is the case. Some of these medications might be banned or outlawed in other countries. Like I know, for example, some stimulants used for ADHD are banned in South Korea. I remember there was a news story about a singer getting in legal trouble because she was bringing her medications home with her from the United States back to Korea, and she was charged with drug trafficking, but really it was just her medication that her doctor prescribed her. And I know that some places you can just show up to the pharmacy and tell them what you want. But I know that that's not. Pharmacists can do some things for you here. They can recommend certain supplements and things like that. But for the most part, you would need a prescription. Yeah, Sierra said she used to work in a pharmacy and they do require a prescription. And I know some of you are not living in the United States, so just keep in mind that a lot of the information that we're sharing here is pretty specific to the American healthcare system and maybe American style of interpreting. I know that some of the standards are different in either Europe or I think they're pretty similar in Canada. I know that some of you are tuning in from Canada. I think they're very similar, but in Europe or Asia, they may be a little bit different, the standards and requirements in mental health and interpreting styles. But if you do remote interpreting for US clients, then this will come in pretty handy.
Yes.
Well, I think it seems that we're not too many questions today. I don't know, maybe everybody's tired today.
Yeah.
Did everybody have a long day?
Yeah.
I have just one question.
Mm-hmm.
Yeah, go for it, Ziba.
About the mental health, depression, and anxiety. These are at the same word and the same level. And which one is more serious?
For which kind of anxiety?
Yeah, like anxiety, depression. These are the same or different?
No,
and
they are
what one
different.
is more serious?
I suppose it depends on your case, right, Lynn?
Yes, it depends on your case as well as your symptoms. So, like I said before, depression or just like any mental illness or just mental health related problem, all of them are valid. All of them can equally be as serious as the other one. It just really depends on the individual and their symptoms and how severe a symptom is. So maybe one case, someone may have very severe depression, and then an individual has mild anxiety, but all all of those symptoms and those mental illnesses or problems are all equally valid. One doesn't mean one can be taken more serious than the other, obviously, with like medication and the type of therapy, but it just really depends on the individual, essentially.
Thank
Yeah.
you.
Yeah, of course.
And a lot of times they tend to go together a lot. I guess if you could think of them as people, you know, they're kind of like best friends who just love holding hands all the time.
Right, exactly.
You know, they're not always together, but most times people have one. They very likely
We'll have the other as well.
Yeah.
Yes, yeah. They tend to go together, yeah.
Thank you.
Yeah.
I would like to apologize, but I am home. My computer's not working well to answer, and somehow my telephone is not allowing me to get into the chat. But I will check later on. But I really enjoyed the training.
Oh, thank you, Irma. Thank you.
Thanks so much for coming.
Yes, thank you. And again, if anybody has questions later on, if you think of a question, feel free to email Robert or I. We will be happy to answer them.
Well, I guess that's it for now. Yeah, we're happy to answer any questions. Send us an email or something, and we'll get back to you. Otherwise, everybody have an enjoyable rest of the day, and hope you have a nice Friday and weekend. And we'll see you next Thursday.
Yes. Thank you, everyone.
Thank you for you guys too.
Bye-bye.
Bye-bye.